We had a communication team that was put together to really look at clinical communication across the system. Primarily, they were focused out of one hospital, and we identified those issues and started looking at various companies that had worked in the communication space. And PerfectServe was definitely a leader there. They had been in the business for a while. And one of the things that we found that we really liked about PerfectServe was the ability to partner with them, the ability to work together jointly on a solution, realizing that no software is perfect when it rolls out, but it does. But they were willing to look at the issues that we had, our ideas and our suggestions about where the product should move, and actually we saw them taking those suggestions and actually turning them into product. So it was a good partnership then in 2010. Continues to be a good partnership going forward. So one of the things on the PerfectServe platform is the ability for physicians to use a smartphone app to actually contact each other, and I think that really enhances clinical communication with physicians so that they can talk to each other either directly if it's important for a consult, or they can talk asynchronously through texts just to relay information. So I think that really helps bring and raise the bar in terms of clinical communication for physicians. How do nurses contact physicians? I think this was the very early days in 2010 when we began, and it was, when you looked around, nurses would keep pieces of paper in the desk drawer, and there was really no one way to contact physicians. So I think PerfectServe's platform lent itself to one number, one web interface to get to the physicians. I think that really enhanced the practice of contacting physicians from the nursing perspective, and certainly brought on some nursing satisfaction around the product. So I think that was really good. Before we had PerfectServe, it was just a matter of phone calls and repeated phone calls. Now they can actually see that the physician has read that information, and they know that something's happening in the background. So for the patient, again, I think it's the ability to receive care quicker and receive care in a timely manner that they actually need. So definitely there's a benefit for the patient. We feel like it's a young company that's really willing to look and work with their clients to come up with really good solutions for communication in the clinical world.